Economic freedom fighters, their big march outside the office of the SA Health Products Regulatory Authority. Look at that, it's on your screen. Over 1,000 people, at least I would say, protesting outside SAHPRA, demanding that the regulator register vaccines produced in China and Russia. SAHPRA has said the manufacturers of the vaccines had not given them the data they needed to consider their applications. Other claims were made today by Julius Malema about corrupt intent on behalf of the SAHPRA chair. No evidence was presented for those claims. Dr. Aslam Dasoo is from the Progressive Health Forum. Dr. Dasoo, good afternoon to you. You've seen the pictures, over 1,000 people there. We all know that Gauteng is the epicenter of the third wave. Your reaction to what we've seen today?
Good afternoon, Stephen, and thank you for inviting me. I think the organizers of this march should be careful for what they wish for. What we saw today in the midst of the third wave, in the midst of the worst pandemic in history, is actually quite shocking. The irony at play is jaw-dropping. The intent of the march, as we hear from the leaders of the EFF, is to save lives. Well, let's look at it like this. Among those people there at the march, there will have been several who are COVID positive, given that statistical fact. Of those, they are going to infect many others, and they will go on to infect others still. And of all of those, many will end up in hospital, some will have to end up in ICU on ventilation, most of whom will die. So that too is a fact. So that is what this march has ended up with, that many of those people in that march will get sick, some will be admitted to ICU, and some will die. Now, once the EFF leadership understands that, I think they may have a different view about what they did today.
That's a very strong comment to make. What you're saying is what happened today was unsafe and shouldn't have happened.
Without a doubt. Completely unsafe. And it's amazing that the authorities let it go ahead. I thought we were a country of laws, and the law is very clear about this sort of thing. I think there is a sense of fear in the state for when the EFF marches. EFF is very charismatic, it's got a very charismatic leader, and somehow the government seems intimidated by that. When the threats were made directly by the EFF against personnel in SAHPRA, I didn't even hear a peep, and this happened a week or two ago. Since then, not a peep from the government, whose obligation it is to protect regulatory bodies. Because these regulatory bodies are not the government, they're the people's regulatory bodies. It's almost like asking the Civil Aviation Authority to license some flightless bird like SAA when it's not yet ready to be commissioned. Who would be happy to fly in such an aircraft? The same thing with SAHPRA. You go into your pharmacy and you get your medicine and you are confident that the medicine is safe and effective. If you have political influence now determining which medicine must get registered for use, what confidence do you have that you'll be getting something safe and effective anymore? So even for the EFF, it's a dangerous thing to undermine a regulator like SAHPRA. It's there for everybody. And we can talk about the vaccines in a moment, but the critical issue is the craven silence of the government to protect an institution of the state, which is conducting itself in a constitutional manner. And I don't understand that. There's been no word, either from the acting minister, from the presidency, from the health department, or from the police. No one has actually raised an objection to what was being said. What was being said, not only libelous, but their physical threats. Where is law enforcement on that? Well, if law enforcement couldn't even prevent what is obviously a breach of the law through this march, we probably shouldn't expect any more from them.
There's a strong comments you make, Dr. Dasoo. There is, of course, a big conversation around what Julius Malema said around the vaccines that he wants to be registered. We're talking about the Sinovac vaccine and the Sputnik V vaccine. One's made in China, one's made in Russia. Does he have a point that they should be registered? How effective are they?
Okay, I think, look, I understand his frustration. I understand Mr. Malema's frustration here. And he started off his speech, I listened to it, with a very rational proposition that we were told we're going to have lockdown, the health system will be strengthened during that time, and vaccines will be procured. Well, neither of those have happened, as is very evident today. We have just under 19,000 new cases today. That information will come to you shortly, I'm sure. 11,000 of them here directly in Gauteng. And so, in the broad scheme of things, we're a population that is unprotected, and he's correct about that. But then he should have taken his concerns and to the door of those responsible, that is the Department of Health. SAHPRA is not able to register vaccines that are not properly applied for, that do not measure up to the standards of all the other vaccines. Having said that, I must say that we have registered 3 vaccines. We've registered the AstraZeneca vaccine, the J&J vaccine, and the Pfizer candidate. We are told by the WHO, who has registered many more, including Sputnik and Sinovac, that they have approved them for emergency use. We have a regulator here that must satisfy itself on that. The middlemen who are bringing these vaccines in are not the manufacturers themselves, so they don't often have all the necessary information, and they have to go and get it, and this takes time. Eventually, I presume that information will come forward, and if all is well, the vaccines will be registered, and they can be then used in the country. What is wrong with that? Well, the only thing that one can say about the entire vaccination program is it's practically non-existent. We've vaccinated some 2 million people over the last 6 months, when China is vaccinating at 20 million a day, India at 2 million a day, the United States, it's 1 million a day, Zimbabwe more than us, Morocco more than us, Kenya more than us. Now, I think that's a valid concern to have, because we are, as a result, completely unprotected. And so as far as the vaccines are concerned, we have no fear that SAHPRA will do the right thing. It is a creature of statute. It is an inanimate object. Not even the personnel working in it can deviate it from its constitutional obligations. And we are quite satisfied. We issued a statement together with a host of medical and scientific bodies condemning the march and the intimidation of SAHPRA. We need SAHPRA intact and its integrity strong. And it's in the interests of the EFF as well that SAHPRA remains in that state.
So, Dr. Dasoo, what needs to happen now? We need to get as many vaccine doses into as many people as possible. There was the announcement by the acting health minister today that the vaccination process for people aged 50 and above is going to start fairly soon. That might show that there's some momentum in the system. Presumably, what you want to see is a lot more doses in a lot more arms very quickly.
Certainly. I believe there's somewhere between 2 and 3 million vaccines that are in stock, and these will be put into arms immediately. The EVDS phased age system has not worked. As we have seen, there's been a very low uptake. 25% of the over 60s only have been vaccinated. Clearly, that system has to be opened up. We need to be able to vaccinate all essential workers. I saw that we started with the teachers, very good, but the taxi drivers need to be vaccinated. The policemen need to be vaccinated. All of those in frontline work, retail staff, have to be vaccinated. So the important thing and the encouraging thing is that business and the government have agreed on a rollout plan, and that's great capacity, and I think we can be grateful for that. However, the limiting factor is the supply of vaccines. That still comes through the narrow bottleneck of the state. That has to be opened up. More of the organized formations of this society must scour the globe, bring in vaccine, and make it part of the national pool. At this rate, we are going to be left far behind. We forget herd immunity, even in 2022. That won't happen. We've already missed all of our other targets. I understand. I heard the acting minister today saying they're going to start over 50s being vaccinated, all well and good, but they must move rapidly with this. The vaccines in fridges are no good. They must be in arms.
So we've got a lot going on here. Are you worried that there is going to be increasing frustration among people as we fall further and further behind other nations? Never mind the EFF for the moment and what they've done today, but are we likely to enter a phase of vaccination frustration? People are going to grow very angry.
Of course, we've seen this before. And you know, patients gasping in parking lots of hospitals, being sent home because there are no beds, to die in the anguished arms of their families is untenable. It will create rage within communities. The government needs to understand that. They do have capacity. What they don't have is the wherewithal, it seems, to act with alacrity at this point. They need to do that. And as far as vaccine supply is concerned, I would be very happy to see many more vaccine candidates registered, but those making the applications must give the information. So Mr. Malema may use his influence very productively. Tell the applicants, bring the information, give it to SAHPRA, so SAHPRA can register these vaccines if they are effective. That's what needs to happen. One last thing I should say, if I may, that the Progressive Health Forum has access, and among its associates, to the best information about the pandemic, about vaccines, about their registration, about rollouts. I make an offer right now to Mr. Malema. We are quite happy to meet with the leadership of EFF and of any other political formation to explain exactly what we know, so that they are equally informed, and then they can do what they need to politically. But I can assure you, this vaccine doesn't care for your the virus doesn't care for your politics. This virus is indifferent to your ambitions, and it is bigger than you, and it is more dangerous than you could ever be. And I'm not talking only about Mr. Malema here, I'm even talking about the government. We are in the grip of an unrelenting adversary here. And we have to show it the necessary respect. Otherwise, our people will remain unprotected and die in their droves. This need not happen.
Dr. Aslam Dasoo from the Progressive Health Forum, thank you very much indeed for your comments this afternoon. Very strong opinions being expressed around the EFF march.